Good morning, everyone. Today, let us see the different ways of oxygen administration for a patient. What all are the equipments we will use for the patient to provide oxygen administration? Let's see one by one. What is oxygen therapy? The administration of oxygen to a patient to prevent or relieve hypoxia. What is hypoxia? Hypoxia is a condition where the body is or a region of a body is deprived of adequate oxygen supply. In the blood, there will be inadequate oxygen supply. So the bodies will be getting blue in color. So we can identify that there is an hypoxia and the saturation level will be low, below the 90. Oxygen is a medication that this has to be administered by with the order only. Physician order we should follow. What is the purpose? To correct the documented or suspected hypoxia, decrease the work of breathing, to decrease the work of heart, especially the myocardium in a patient with a heart disease. This is the reason we are administering mild oxygen patient who is suffering from myocardial infarction, MI. Now let us see what all are the equipments we are using for administering oxygen. First, let's see low flow oxygen delivery system. This system provides oxygen at a flow rate that does not meet the patient's full inspiration needed. The patient's breath is mix of atmospheric air and supplemental oxygen. When we are connecting a low flow oxygen system, patient need to be take breath themselves. It is the patient breath will be mixed with the atmospheric air. So we are giving a very small amount of oxygen. The first equipment is nasal cannula. It's a device with the two prongs and the flow rate will be 1 to 6 liter per minute. Oxygen concentration it is delivering 24 to 44% of oxygen, FiO2. Advantage, what is the advantage? Patient will be very comfortable. They can have the food when they are taking oxygen administration. They can drink, they can talk. They will be a bit free. There are some disadvantages also. It can cause the nasal dryness and skin irritation. Next is simple face mask. A basic mask fit over the nose and mouth. The oxygen flow rate is 5 to 8 liter per minute. Oxygen concentration is 40 to 60% FiO2. It's a simple use, effective short-term therapy. There are some drawbacks. It can be interfere the oxygen administration and it will give uncomfortable to a patient. While talking, eating, we need to remove sometime. So interruption can happen. This is the drawback of this equipment. Next is partial rebreathe mask. This bag is not used for emergency high concentration needed. This bag is having feature is one face mask will be there and one reservoir will be there. And there is no valve. There is a chance of mixing with the atmospheric oxygen while patient breathing. Oxygen and air that will mix each other. When they exhale, the first 1/3 of their breath goes back to the reservoir bag and it is mixing with the fresh oxygen supply. It's a mask with a reservoir bag attached. We can see the reservoir bag. It is attached with that. The patient exhale air from the first third of their breath goes back into the bag. It is increasing the FiO2 of the patient. The flow rate is 6 to 10 liter per minute. Oxygen concentration is delivered 50 to 75 FiO2. The partial rebreathe mask and non-rebreathe mask look like same, but there is valve for the non-rebreathe mask, and the difference is there is no valve for the partial rebreathe mask. That's the difference. Here now we are going to learn about non-rebreathe mask. What's non? It has one valve, one-way valve. It is located between the mask and the reservoir bag, as well as on the sides of the mask. The function is the valve prevent the exhaled air from entering to reservoir bag and also stop the room air from being inhaled. So in the partial non-breath mask, we have seen already it is mixing with the when patient inhaling, exhaling, it is mixing. But here in the non-breath mask, that mixing is not happening. This ensures the patient is breathing almost pure oxygen from the reservoir bag. But we are giving from the cylinder, that is a pure oxygen. That oxygen only patient is breathing. While exhaling, it is not entering because there is a valve. Through the valve, it will go out, whatever we are exhaling. The flow rate will be 10 to 15 liter. Oxygen concentration delivery is happening 80 to 95 percentage, and it is usually for the critical patients who need high concentration of oxygen. Okay, so for this is the benefits of non-rebreathe mask. Here the clear picture is the non-rebreathe mask. You can see the valves in the both side of the mask, and inside also there is a valve. Okay, this is a bag and this is a face mask, and this is the connection of the oxygen. We were looking about low flow oxygen delivery system up to now. Now let's see high flow oxygen delivery system. In this system, oxygen is providing in a high flow concentration. FiO2 will be delivered high. The first equipment is Venturi mask. Venturi mask is a type of oxygen delivery device used to provide a specific, consistent, controlled, concentrated oxygen to a patient. And it is having a Venturi effect. There are different color coding adapters are there for this Venturi mask. Along with the mask, it is coming, and there are different percentage of oxygen FiO2 is administering to the patient according to the color code. Let's see one by one. The Venturi mask flow rate is 4 to 12 liter per minute. It's very based on the adapter. Oxygen concentration delivery is a very precious FiO2, 24 to 60 percentage of FiO2 we can give. Ideal for the patient with a chronic obstructive pulmonary disease, COPD patient, who required consistent low dose of oxygen concentration. In the Venturi values, you can see the picture according to the color code, what is the liter per minute and what is the FiO2 delivery is happening. It is mentioned here, blue 2 to 4 liter and FiO2 is 24. Accordingly, white, yellow, red, green. Different colors, different liters of oxygen we can provide, and FiO2 also is getting different percentage. We can just go through this picture. Next is aerosol mask or face stent. This mask we are commonly called nebulization mask. When we are using it is using for delivering a high humidity oxygen via nebulizer. A phase stent is also an alternative method for a patient who cannot tolerate the mask while giving the nebulization. Okay, we can connect this one with the nebulization machine. That moment we are not giving any oxygen for the patient. The patient need to get high flow oxygen plus nebulization. That moment we were connecting this mask into a humidifier. The patient who is having very thick secretion or the patient who is from post tracheostomy care, those patients we are using nebulization mask. Next is ambu bag or bag valve mask, oxygen delivery method. This we are using only during the emergency situation. This is a device using to provide positive pressure ventilation to a patient who is not breathing or not breathing adequately. The mask of the ambu bag is holding C and E technique. Just before intubating the patient, we will pre-oxygenate the patient with the help of ambu bag. Let's see the parts of ambu bag. Blue in color, that part is expiratory valve. PEEP valve will be there, that is movable valve up and down. And self-inflammatory one bag is there. Air inlet one-way valve on oxygen reservoir socket is there. Air inlet and pressure release valve you can see here. And oxygen inlet and tubings you can see it is connecting over here. Oxygen inlet, in that we are connecting the oxygen tube. The other part of the oxygen tube is connecting to oxygen cylinder. The last, the L reservoir bag you can see, so that the oxygen will come and collect in the reservoir bag. Face mask, pop-off valve. These are the parts of the ambu bag. High flow nasal cannula or HFNC. During COVID season, this was very commonly using almost all of the hospitals. Intubating a patient was very difficult during the COVID time. So we were, instead of intubating the patient, we were giving the oxygen supply through HFNC, high flow nasal cannula, a device that delivers the heated and humidified oxygen at a very high rate. The flow rate is 60 liters per minute. For the patient with respiratory distress who need high concentration oxygen, disease conditions like COVID, we have to use this HFNC. What is the nursing responsibility during administration of an oxygen to a patient? Assessment. Assess the patient's respiratory status and oxygen saturation before, during, after administration of oxygen. Prescription. We have to always verify the prescription before administering the patient. Oxygen. What is the rate? What is the method doctor has prescribed? Patient education is very important. Provide education. What is the benefit of giving oxygen administration to a patient and the family members too? Monitor the signs of hypoxia, hypercalcemia, high CO2 level. Safety measures. We should take care of the oxygen safety precautions that we have to follow. Example, no smoking signs. No smoking signs, keeping oxygen tanks away from the heat. Skin care, skin irritation, breakdown and all, we have to check. Humidification, use the humidifier if you are giving more than 4 liters per minute of the patient. Always use humidifier so that humidified oxygen we can give. This can prevent the breakdown of the nasal mucous membrane and oral mucous membrane of the patient. Thank you everyone. Please don't forget to subscribe my channel and please press the bell icon too so that you will get all my new updates. Thank you.